My name is Matthew Sarvesvaran. I'm an RMO currently doing a term as a medical leadership advisor for the Department of Health, and I'm going to talk to you about service improvement methodology. Service improvement projects allow meaningful changes to be made to healthcare systems and patient safety. But what is service improvement? Put simply, you identify something that isn't working and you go about fixing that problem. Sounds simple, but in healthcare there are often multiple barriers to achieving this simple concept. To help understand and break down these barriers, there needs to be formalised, evidence-based approaches to help tackle this. As a consequence, various service improvement methodologies do exist. However, in Western Australia, the DMAKE methodology is the one that tends to be used the most. DMAKE stands for Define, Measure, Analyse, Improve and Control. We liken this approach to being a doctor trying to figure out what is going wrong with a patient. As clinicians, we're taught that most of the information we need to make a diagnosis comes from the history taking, which is supplemented by your examination findings. You would not make a presumptive diagnosis and treat a problem without the key information first. The same is true with service improvement. Quick fix solutions to superficial issues is the medical equivalent of a band-aid covering a symptom. It only hides the problem without addressing the true underlying issues. The Define, Measure and Analyse section of the methodology is key to getting to the root cause of the problems. To illustrate this, let's look at the real-life case of the Washington Monument. In the early 1990s, the Washington Monument had a big problem. It was disintegrating. As an iconic landmark for the city, a team of investigators were brought in to see how they could help. Their considerable success with the project ultimately boiled down to their unrelenting persistence in asking the question why. They first asked, why is the monument disintegrating? The main reason was their use of harsh chemicals to clean it. But why the use of harsh chemicals? It was necessary to clean up large quantities of pigeon droppings. Now, it would have been easy to stop there, which is what happens in a lot of cases, and expensive solutions, such as building spikes on the monument to keep the pigeons off, may have been implemented. But fortunately, the team kept on asking why. Why are there so many pigeons? After some research, they discovered that this was because there were lots of spiders on the monument. Why so many spiders? Because the spiders were eating midges. Why so many midges? Because they were attracted to the light shining on the monument at the dusk. It was at this point that an elegant solution to a complex problem was suggested, and this was simply to turn the lights on later. This meant that there were far less midges, far less pigeons, less harsh chemicals, and ultimately a healthier monument, all for a cost saving as the lights are being turned on later. This emphasises the power of why, and how a deep understanding of the root causes of the issues can lead to simpler, more effective, and less costly solutions. The Improve and Control section of the methodology is when you can go about actually trying to fix the problem, but only when you have a true understanding of the issues at hand. Making your solutions stick and making them sustainable can be tricky. To make this less of a challenge, getting the right people involved in the process is key. The right people can actually be quite broad. You can consider anyone who is affected by your project as a right person. These right people are formally referred to as your stakeholders. One of the keys is getting them engaged in all steps throughout the process, from the initial sessions, where you're trying to get to the bottom of the problem, right through to the solution stage. They will be the ones giving you all the necessary information about the problems, and most of the time will direct you to the solutions, as well as ensuring that your project is sustainable. Having them involved in the process and genuinely addressing their needs and concerns will mean that there is much less resistance to change when it comes to implementing your ideas. But don't take my word for it. We're about to hear from 3 participants who have been through the service improvement journey and their experience with it.